Hello everyone, Dr. Ben Frimpong here again, and welcome to the TutorMed channel. We are going to continue our discussion on chest pain of pericardial origin in the adult patient. In this video, the condition we will focus on is cardiac tamponade. Let's begin with this picture, which shows the heart and its covering, the pericardium. Remember, in our last video, we said that there is a thin film of serous fluid between the visceral and the parietal pericardium, known as the pericardial fluid. This serous fluid permits the two pericardial layers to glide over each other with minimal friction during heart's movement. Cardiac tamponade occurs when there is excessive pericardial fluid accumulation, sufficient enough to impair the diastolic and or the systolic function of the heart. And so there is so much fluid around the heart such that the heart cannot relax to receive the right amount of blood to pump around the body. And so one consequence of that is blood pressure dropping and the organs starved of oxygen because of the decrease in blood pressure. Now, what is the amount of fluid required to cause cardiac tamponade? Answering this question, the major determinant of whether a certain volume of fluid can cause cardiac tamponade or not is the rate at which that said amount of fluid accumulated. In other words, did it occur suddenly or gradually? Did the accumulation of fluid occur suddenly or gradually? Now, as little as 200 mL is needed to cause tamponade if the accumulation occurred suddenly. For example, if you have a sudden bleed into the pericardial space following a chest injury, just 200 mL can cause tamponade because the accumulation was sudden. However, the fluid has to be as massive as over 2000 mL or 2 liters to cause tamponade if the accumulation occurred rather slowly or gradually. And so, in a nutshell, sudden accumulations or pathologies which cause sudden accumulation of pericardial fluid need less volumes to cause tamponade compared to pathologies which cause slow or gradual accumulation of pericardial fluid. And so here, the major determinant is not necessarily the volume of fluid, but the rate of accumulation. Now let's look at the common causes of cardiac tamponade. Number 1, idiopathic pericarditis, meaning inflammation of pericardium with an unknown or unidentified cause. And so inflammation of the pericardium can produce exudates which can accumulate in the pericardial space, causing cardiac tamponade. The second cause is secondary pericarditis, meaning pericarditis with an underlying cause, including neoplasms in the pericardium, and so pericardial tumors, and then TB pericarditis. All these can exude fluid into the pericardial space, and the accumulation may be sufficient enough to impair cardiac activity, resulting in cardiac tamponade. Then we can have bleeding into the pericardial space. Bleeding into the pericardial space may be caused by aortic dissection, cardiac trauma, maybe following a road traffic accident, cardiac surgeries or cardiac operations, and then treatment with anticoagulation. So all these can cause bleeding into the pericardial space, and the volume of blood accumulated, and more importantly, the rate at which the blood accumulated, can cause cardiac tamponade. And so, what are the clinical features of cardiac tamponade? Well, remember that the common causes included pericarditis, and so the clinical features may not be very different from pericarditis like we discussed in our previous video. Of course, other causes like recent chest trauma, cardiac surgeries should also be ascertained, because we said they can cause bleeding into the pericardial space that can result in cardiac tamponade. However, there is a diagnostic triad for cardiac tamponade called Beckstriad. Beckstriad is made up of hypotension, raised jugular venous pressure or raised JVP, and then muffled heart sounds. It is important to note that Beckstriad is very diagnostic. However, it's not always present. Now, like I explained earlier, the heart cannot relax adequately to receive sufficient amount of blood to pump around, and so this results in a reduced cardiac output, and that explains the hypotension in the triad. The raised JVP is explained by the fact that the right atrium cannot relax adequately to accept blood because of the surrounding fluid, and so the veins draining into the right atrium becomes engorged, including the superior vena cava. So the internal jugular vein, which contributes to the superior vena cava, also becomes distended with blood, and that explains the raised JVP in the Beckstriad. The increased amount of fluid around the heart does not allow for proper sound transmission when the heart is beating, and so because proper sound transmission is not permitted to the pericardium, the heart sounds are muffled when the cardiac areas are auscultated. Now, apart from the Beckstriad, another important finding is Pulsus Paradox. What is Pulsus Paradox? Pulsus Paradox is a decline or decrease in systolic blood pressure more than 10 millimeters of mercury during inspiration. Now, there will be a separate video to explain the physiology behind Pulsus Paradox, but for now, kindly note that it can also be a feature in cardiac tamponade. Whenever the patient takes in a deep breath, the systolic blood pressure decreases by more than 10 millimeters of mercury. And so quickly, let's discuss the investigations and treatment modalities for a patient with cardiac tamponade. One very important investigation to begin with is the plain chest radiograph. The plain chest radiograph would show you an enlarged cardiac silhouette. The enlarged cardiac silhouette indicates that there is excessive fluid in the pericardial space, and so it makes the heart looks enlarged, but actually it's because of the fluid within the pericardial space. Again, there may be rib fractures if the underlying cause of the cardiac tamponade was chest trauma, especially from road traffic accident. Another investigation to do include the 12-lead ECG. Now, I have made a short but comprehensive video on the ECG for low voltages and pericardial effusions. The link to that video is in the video description below. Kindly have a look at it. I have discussed the ECG of cardiac tamponade. However, the characteristic feature there is electrical alternance. Please have a look at that video if you haven't done that yet. Then a bedside echocardiogram can identify the fluid and the amount of the fluid. For the treatment modalities, we can do an imaging or an ultrasound guided pericardiocentesis, where fluid is drained from the pericardial space appropriately. And then the next treatment modality is to do a surgical drainage through a subxiphoid thoracotomy. And so basically, This is the discussion on cardiac tamponade. I trust it helped. Please do not forget to like and share this video and subscribe to our channel. Put us on post notification if you have not done that yet. See you in our next video, and until then, bye.